Legislation is law which has been promulgated by a legislature or other governing body or the process of making it. Before an item of legislation becomes law, it may be known as a bill, and may be broadly referred to as legislation, while it remains under consideration to distinguish it from other business. Legislation is synonymous with statutory law, the laws that have been enacted by the legislature as well as those still in the process of being enacted. The profession of pharmacy is an integral part of the healthcare system worldwide. In the past, pharmacists were responsible for dispensing medications only. Today, pharmacies with well-organized practice can go a long way to ensure quality healthcare for the patient. Gradually, the traditional role of pharmacists is expanding, and now pharmacists are playing a role as a vital team member in the direct care of patients. The first apothecary school was started in 1847 at Madras Medical School, where 5 candidates were admitted for this course, of which 3 passed in 1852. Madras Apothecaries Society was established in 1864. The Pharmaceutical Association was established in 1923 and later its name was changed to the Pharmaceutical Society of India in 1925. It was in 9th century in the civilized world around Baghdad that the profession of pharmacy started acquiring shape.
It slowly spread to Europe as alchemy and finally developed into chemistry. The first known chemical process was carried out by the artisans of Mesopotamia, Egypt, and China. Pharmacists play a major role in providing healthcare services by means of community pharmacy services in rural areas where physicians are not available or where physician services are too costly for meeting the healthcare necessities. However, in the 19th century it completely sprouted out from medicine and started developing as a separate profession. The medicament commonly produced was simple elixirs, spirits and powders, in contrast to the complex pharmaceutical remedies of the present era. The 19th century witnessed various milestones being set in the field of pharmacy. In 1821, first school of pharmacy was established in U.S. at Philadelphia. The first U.S. pharmacopoeia was published in 1820. American Pharmacist Association was founded in 1852. The first national formulary was published in 1888.
The inception of pharmacy profession in India was marked by the first class of the chemist and druggist conducted at the Madras Medical College in 1870s to train students to gain skills in pharmacy practice. Pharmacy education pattern was based on the instructions provided by the Pharmaceutical Society of Great Britain. A formal training of the compounders was started in 1881 in Bengal.
The pharmacy profession entered India almost simultaneously. For almost half a century not much progress was noticed, until B.Pharm course was started in 1937 at Banaras Hindu University and in 1944 at the Punjab University, Lahore, now in Pakistan. The B.Pharm course at BHU was industry-oriented while that at Punjab University was oriented towards pharmacy practice.
In India, the term Beshaj or Beshaji was used in ancient time, which was equivalent to pharmacists, one who engaged in the preparation of drugs. They were also involved in identification, procurement and standardization of drugs from various natural available sources. The senior people from tribes used to exercise their own experiences, and repeated practice resulted into compilation of all such knowledge into the apothecary, a person who prepared and sold medicines and drugs. It was considered that a person involved in this profession was associated with some spiritual power, and drug along with its natural effect had some magical involvement in cure of disease. These persons were
in India. The first pharmacy class was started in 1860 at Madras Medical College. The class was discontinued after 1861-62. In 1886, the class was continued with increase of duration of study to 2 years, and entry qualification for it was middle school examination. In 1893, the minimum qualification was raised to matriculation. It was the only course of its level. The recommendation of Drugs Inquiry Committee became a ray of hope for a statutory regulation of the pharmacy profession. In fact, Madras Medical College changed the name of Chemists and Druggists course to Diploma in Pharmacy in 1940. The first education regulation, ER, was framed in 1953, which was subsequently amended in 1972, 1981 and 1991 to regulate the pharmacy education. This regulation prescribed 2 years academic training with minimum qualification of matriculation or its equivalent examination with science as one of the subjects. Dr. Rohatgi suggested that the Pharmacy Council of India should conduct the examination for diploma course in pharmacy. But his suggestion was not accepted. Only the suggestion regarding practical training of not less than 750 hours in a recognized institution, hospital, pharmacy or dispensary, was accepted by PCI and made compulsory after completion of regular course. Third ER was passed in 1981, in which the course of study was reframed. In 750 hours practical training, 375 hours were devoted to actual practical training. In the present year 1991, the minimum qualification for the course was changed to 12th science and the minimum period for practical training was reduced to 500 hours. Coming to the summary of chapter, in India, the pharmacy profession was started since Ayurveda system of medicine. The profession was then progressed in British rule. Pharmacy education was started before independence and has constantly evolved. Presently, the network of pharmacy colleges and universities is established. Pharmaceutical industry in India has grown since independence. The medicines were imported largely then, but now we are not only self-sufficient in producing medicines but are also cheapest yet quality producers in world. Pharmaceutical industries are growing fast in terms of production of new drugs as well as production capacity. Out of top 10 pharmaceutical companies in 2010, 8 are Indian companies, but this scenario is swiftly changing as the multinational companies are overtaking the Indian companies through mergers and acquisitions.